Hey YouTube, what's up? Dr. Brianna Durand from Empower Physiotherapy here in Seattle, Washington. Today I had a patient with a new acute onset knee injury, with a bunch of swelling and inflammation, and I decided to make a video on what to do when your knee is swollen and painful, because at this phase of the healing process, when the injury is still really new, we want to respect the tissue, give it time to heal, but we also do need to move it. There's a lot of evidence that we don't want to stay too static. One, that can be a little bit dangerous from a blood clot standpoint, depending on your medical history, but also because we need good, healthy blood flow to get to those tissues, help it healing, carry away some of the not so great stuff that's sticking around due to the inflammation. Also, it'll just help you feel better and get back on your feet faster. So let's go over a few exercises and ways that you can self-manage your pain in between appointments. The first one is called a long arc quad, and you can do this anytime. Let's say you're sitting and you have to work and you don't have access to the ability to recline and keep your leg elevated. We still want to stay moving. Whenever we contract muscles, it helps to push all that extra fluid back into the back towards the heart and helping it circulate around so it doesn't just accumulate in the joint. So a long arc quad, you're just going to use your quadricep muscle and straighten your leg all the way up and come all the way back down. And if you don't have full range of motion, that's okay. Do whatever you can and try to get a little bit further with each repetition. And if you don't have something blocking you, unlike I do with this bench, try to bend your leg a little further each time too. So yes, you want to try to get a little bit closer to fully straight, but also instead of coming back to 90, see if you can bring it in closer. Slow and steady wins the race here. And we want to try to abide by that stoplight analogy that I think I've brought up before. So when tissue's healing, we don't necessarily want to adhere to the pain at all times because we can become fearful and avoidant, but we also don't want to just push past it either. One, because we don't want to cause more damage potentially, but more importantly, we don't want to create an association with the brain and whatever that movement is. Let's say it's walking, we don't want it to learn that it's painful. So the stoplight analogy is where I want you to imagine like a green, yellow, and red light. You're probably familiar with that 0 to 10 pain scale, 0 being I have no pain, 10 being it's the worst pain imaginable, like you could, punch the incision and it wouldn't hurt anymore. Really, really bad. So a 0 to 3 is your green light, meaning I want you to try to keep going. Gentle, of course, but we want to try to keep going. 4 to 6 is your yellow light, so slow down. So if I suggest try to do 10 of these long arc quads every 30 to 60 minutes, but you have a 5 out of 10 pain, maybe you only do 5 repetitions and then take a break, try the other 5 later. If you have a 7 out of 10 pain or greater, that's your red light. That's where you want to totally stop. And if you're out trying to walk around, you want to take an Uber home or something. You don't want to try to keep cranking through that tissue. Okay, so let it guide you, but don't let it be in the driver's seat entirely. Okay, so this next one is called an ankle pump, or ankle circles, or spell your name with your ankle, whatever kind of variation you like. And this is great because it can be done sitting or laying down if you have that option. Basically, you're just gonna do what it sounds like. You're gonna pump your ankles like you're stepping on a gas pedal, and then you're gonna stretch your toes up towards your shin. Okay, and this can be done with your leg bent or straight. Doesn't really matter, whatever feels good, but you want to try to get through that full range of motion. Okay, so sitting or laying down, and then maybe you have access to a standing desk, which is awesome. You can stand up when you have swelling, but you don't want to stand up for long durations of time. So probably no more than like 30 minutes to an hour, depending on how bad your swelling is. Set a little timer on your watch or on your phone to remind you to change position. But if you do have the ability to stand, if you have the ability to weight bear safely, according to your healthcare provider, you can do little heel raises and rock back. Heel raise and rock back. Again, holding on to something so that you don't lose your balance, not a balance challenge here. The whole purpose here again is just to get the blood moving and helping to push that fluid back up towards the center of the body. Another one is what I just did, a sit to stand. So when getting out of a chair, we have a big tendency to lean onto the non-painful side. So if your healthcare provider has cleared you, you want to try to slowly, again, using that stoplight analogy, respect the tissue, but try to keep using it. So to make it easier, scoot to the edge of the chair, almost to the point that your butt is like almost coming off. So if we're way back here, it's going to be harder. Scoot to the edge of the chair, and then we also tend to like to leave our legs out here. But now you have a big lever arm to move over. So bend your legs a little more, further than you think you need to, okay? And then you wanna try, you can push off here or push off from your legs. If you have armrest, that's great. Lean nose over toes and try to come up evenly with both legs. You might still use your non-painful side more, but try to use both legs and then come back down. So again, if you're working and you have to go about your day even though your knee's hurting, try and do 5 to 10 of these every 30 minutes to an hour. It will really add up over time. Okay, again, being mindful. Also, when inflammation is there, if it's red and warm to the touch, if it's swollen, you can always use ice. If you don't have any skin sensitivity issues, you know, if you can feel when it's cold, etc. So if you're diabetic, you might want to ask your healthcare provider in case you have issues with sensitivity of your skin and the nerves in your skin. But you can put ice on your leg when your leg is out, especially maybe something propped under here, and you want to go like 20 minutes on, 20 minutes off. Not much longer than that, because we don't want to cause any damage, because you might not feel when it's getting super numb, but that can help. Definitely try not to use heat when it's swollen, because that can make more fluid accumulate in the joint. Okay, now let's say that all of those are really still too painful. It doesn't mean you can't get your muscles on in some capacity. The stronger your muscles are around your knee and around your hips too, the more we're going to be able to offset the pain of that knee. So you can do what are called sets, which is where you just engage a muscle isometrically and try to help kick it on. And this is also shown to help with pain management. So these are best done with your leg out or laying down. If you have sciatica, history of sciatica, or nerve tension down the back of your leg, just be cautious of this. But this first one here is called a quad set. And what I'm going to do is I'm going to engage my quadricep muscle, preferably enough so that my heel comes off the ground or off the surface, okay? And if you can't get your leg fully straight, it hurts too much, you can prop something underneath it, okay? Hold for 6 seconds, relax for 6 seconds, repeat that 6 times, okay? So that's for the quadriceps. The next one is for your hamstrings on the back of the leg, and it's basically just that. I'm gonna dig my heel into the surface below me, and if you want, you can feel your hamstring on the back of your leg, and you should feel it kick on. And same thing, hold for 6, relax for 6, repeat 6 times. And these are gentle enough, they can really be done as often as you want, as long as you're following that stoplight analogy. You can also, if you're able to lay down, you can put something between your legs, like a pillow or a book or a soccer ball, and you can squeeze your inner thighs, hold for 6, relax for 6, and also push into your own hands. So I'm trying to open my knees out into my hands, contract for 6, relax for 6, okay? So all of those exercises are going to help, find that nice little balance of keeping the knee moving, keeping the muscles engaged, helping to get that fluid out of there, but not overdoing it too fast and giving the tissue time to heal. Please leave a comment, let me know if you enjoyed this, and share it with someone who you think would benefit from it. Hit that subscribe button, and I will see you next time.